So the other great speaker is Paul Clyde, who, if you look at it from the outside, he's the guy who runs the William Davidson Institute, which is one of the world's great centers for entrepreneurial doing good, a big building in Ann Arbor. But of course, that's not what I remember. I remember wandering through Uganda with Paul and seeing this guy who's just a fantastic intuitive leader that could talk to a nurse's aide and the Minister of Health at the same level of dignity. Paul's pretty darn famous for taking apart the healthcare systems and figuring out how they can survive in some of the toughest situations. And I've always wanted to tap his brain on rehab. We did a lot of that on our trip and in some of our writing together, Paul. But I'm really delighted if you could give us a few minutes of where you're from and what you're up to in general before the fellows start quizzing you guys. That'd be great, Paul.
Well, thanks, Andy, and thanks for the introduction, which I think is at best partially warranted. But let me make clear from the beginning that rehab is not, I'm not a doctor, and rehab is not my specialty. I'm an economist, and so I think about these things from a variety of different perspectives, but I noticed a lot of the questions were about getting the government involved and getting government support by it. One of the things I'd like to talk about more is engaging the private sector and the motivation, the interest from the private sector. And let me tell you, I'll tell you about my background a little bit and you'll see why. So my PhD is in economics, as I mentioned, and I started out in the US government, working with the Department of Justice and the Antitrust Division on mergers and acquisitions. And as part of that, we would do a lot of cost benefit analysis of the kind of, and the type of thing that you're talking about here. What's the benefit of rehab? So we would analyze some policy questions from that perspective. But as part of that, I lived in Slovakia for a year in 1993 and was working with the Czech and Slovak governments. And I came back from that convinced that we could have perfect policy on these things, but unless the private sector was really thriving, we weren't going to see the transition of these economies that we were hoping for. And so I still wasn't really focused on healthcare at that point, but I was, throughout my career, I've been focused on low and middle income countries. And what it used to be transition and developing economies, and then it moved into emerging economies. And now the trend seems to be to refer to them as low and middle income countries. But the same kind of thought process was going on through all of that. And when I came back, I learned about this institute called the William Davidson Institute that was really, in my view, unique at the time in that it was focused on the private sector. So WDI was established in 1992, and it was established by a fellow named Bill Davidson, who said the mission of it was to equip economic decision makers in emerging countries with the tools of commercial success. And so he's very much focused on the business aspect of it. And today that's not that unusual, but when I was working in this field in the early 90s, the vast majority of the work that was going on was at the policy level. It was at the government level. It wasn't thinking about the private sector and the development of the private sector. So that really caught my attention. And I moved to Ann Arbor from Washington, D.C., in 1997 and have been on the faculty at Ross, at the Ross School of Business since then, and worked with WDI from the very beginning. And then in 2014, I moved over permanently. So I still have a joint appointment. I still have an appointment at Ross, but my primary job is at the William Davidson Institute, as Andy mentioned. And we have 4 areas that we focus on there, one of which is healthcare. And so we're focused on the business of healthcare. So that sort of is the background from that perspective. On the healthcare side, my first interaction with that was with someone who's become a good friend of mine named Dr. Aravind, who is in India. And it's relevant for this because, so Dr. Aravind is part of the Aravind Eye Hospital, which you may or may not have heard of. It's by some measures the largest eye hospital in the world. It's got a series of different eye hospitals in southern India, Tamil Nadu primarily. Also does a lot of consulting. And I met Dr. Aravind when he was getting his MBA at Michigan in 1999. And he was telling me what they did. And at the time, it was primarily cataract surgeries. And they offered about 70% of them for free, and they charged for the other 30%. And they were able to cover all their costs. And this was really striking to me because there was a lot, I had seen things going on in global health, but most of it was looking for outside funding of some sort. And they didn't need any outside funding. They were able to completely sustain their business through their own internal operations. And I bring that up because that model had a lasting impact on me. I still remember exactly where I was when he was telling me about this, because I had spent quite a few years in development economics, and I'd never heard of a model like this. And I have since learned that it really is an amazing one. Dr. Arvin himself, he's got an enormous amount of energy. He's more than I do, probably at Andy's level. And he started his own rehabilitation facility in 2010. And so for about the last 10 years, he's had this organization called Live Well that he started, in addition to his main job, which is running one of the largest physical hospital in the R&I system, and being on the leadership team of that. And he is an ophthalmologist, so he didn't change his medical training, but he started up this rehabilitation facility with much of the same model, where he's got paying patients coming in there, and they support, he's able to cover all of his costs through what he does. And in India at the time, there were very few, if any. I mean, I'll let you all know more about this than I, but my understanding from him was finding a PM&R doctor in India was virtually impossible. CMC Vellore, I think, was doing some training of them, but I believe it was the only one in India that was training any of them. You, again, would know more than I on that, but I just know he had trouble finding one. And today, his rehabilitation facility was unusual at the time. And today, it's there are a number of them in India, and it's grown significantly for a variety of reasons. There's been a demand there. But that was my first interaction on the healthcare side. And then after that, in about 2005, 2006, we started working with hospitals, first in Uganda, and now we work with hospitals or clinics or healthcare providers of one sort or another, everywhere from Ethiopia, Uganda, Kenya, India, Sri Lanka, Senegal. We're in a variety of different places, and we use student teams, MBA teams of MBA students who are on average, 29 or 30 years old, so they've had some work experience, and they'll go out and do consulting projects. And we have our own staff at WDI, but when I use student teams, I'm able to do that at very low cost, or basically the healthcare provider just provides them the team with housing when they're there for the 2 to 4 weeks that they're there. And then the team will come up with whatever consulting project the hospital has asked for. And we've done over 100 of those projects over the past 20 years, many with Arvin, but many with these other hospitals. And so that sort of is where I've been focused, and really focused on the business model side of things, of how can you provide healthcare in these markets and cover your costs at the same time. And sometimes it's a cross-subsidy model that you have a group of patients that you're charging, and you're cross-subsidizing that. Andy mentioned the one around Uganda. That's what we were looking at there, and we actually made it fairly far down the path there. And there is a doctor there, an orthopedic surgeon, who we worked with quite closely, and who still has a practice that's thriving there. And I think the possibilities on that front are enormous, and we can talk about those a little bit more later on. But that's sort of a brief background on me and my interaction in the healthcare side of it, and where I'm coming from.